Dr. Mache Seibel, and I am the founder of drseibel.com, DOCTORSEIBEL.com, and I'm also a professor at the University of Massachusetts Medical School. And my mission, my passion, is to help women in and around menopause to stay well. I want to give them the information that they need so that they can make the right choices to live a full, vibrant, happy, and healthy life. Fertility declines substantially after the age of 35, and I don't think anybody's talking to women about this. I think there's so much misunderstanding that because someone in the news can have a baby at 40 or 45 or 48 and what have you, very seldom do they talk about either how much effort that celebrity went through or the fact that that celebrity might have in fact done egg donation and gotten her egg from a younger woman. I think the most important thing that I can explain to women as they're anticipating having a child is making a baby takes time. Even in perfect circumstances, up to 12 months of trying without success is required before we call it infertility. So if you're thinking of having a child, it could take 3 months, 6 months, 12 months, and that would be totally normal, totally normal. The thing is that nature is really pretty unkind because as we get older in every facet of our life, it doesn't matter if it's in sports, it doesn't matter if it's in childbearing, it takes longer to do those things that used to happen pretty quickly. Doesn't mean it won't happen, but typically it takes a bit longer. We have to just anticipate that. On the one hand, the things we're able to do today are just fantastic. We can freeze embryos. We can even freeze eggs, unfertilized. But the thing is this, while these are still very new procedures, the notion that this is going to be a given, that an egg that is unfertilized can be frozen, then thawed and fertilized, is not yet ready for prime time in terms of a given. So if you are a person who's thinking about having a baby and you are in a circumstance where you have this situation where you have breast cancer or something like that, and you have to freeze an egg, because those are the realities you face, by all means, that's a very powerful tool. But if you're thinking, I'll work another year or two, and I'll just wait, and I'll have these eggs ready for me when I'm ready, it may or may not be effective, because the most effective situation is maybe 10%, 15%, 20%, even if it's 30%, that's a long way from the 100% that many people invest their hope and their faith in when they freeze something with the expectation of success. The cost of reproductive technology is one of the drawbacks. Now, fortunately, it turns out that there is insurance available for the procedure in a growing number of states, but still a minority of the states. So many people who don't have insurance are going to face a situation where economically this may or may not be possible for them to happen. And that's a very tough circumstance to be in because it feels unfair, and probably it is unfair. Because a lot of times the insurance industry is worried that people will overuse it, and I know I was in Massachusetts. It was one of the very first states where insurance was covered. I went and talked and advocated for women at that time about it. The insurance companies were really frightened that it was just people would go on and on and on and on. But I published a paper a number of years ago that showed that with in vitro fertilization and all these technologies, when they do work, if they're going to work, they tend to work pretty fast. So if a woman does do in vitro fertilization, it's about 85% of the pregnancies are going to happen in the first 2 to 3 tries. It's not something that people should think they have to do 10, 20, 30 times. That's just crazy. And it's a lot of risk and wear and tear on a woman because you've got the medications, you've got a minor procedure, the anesthesia, and all that going on. But most people it takes place, and success takes place in about 2 tries. So hopefully insurance will cover at least 1 or 2 tries for everyone, because if you really look at the cost of that for an insurance premium policy, if everybody chipped in on that one factor, the cost would be about $1, $1.50 a month, something like that to a premium, which would then be equitable for everyone. when a woman hits 40 and she's thinking about having a baby, there's some advice I would give to everyone, and that is don't wait to see a fertility specialist. And the reason for that is you may need some help. There could be a fertility factor. There could be a problem with your partner's sperm count. There could be a problem with some scar tissue. There could be a problem with the quality of the ovulation. But if you're thinking, oh, that doesn't really matter, because what I can do is I can go do in vitro fertilization and boom, I'm going to get pregnant right away, it's going to solve all my problems, you will be disappointed, because the success rate as you go over 40 is really only about 8%, something like that. And as you hit 42, it goes down to really lower. It's really low. So you have to understand that the age is a barrier for which technology can't always overcome it if you're going to use your own egg. I'd like to offer some advice to you if you're thinking about doing in vitro fertilization and the fertility center is encouraging you to do egg donation. I'll sum it up like this. It's your life. And it's your right to do exactly what you want to do. It's also your money, your time, your effort, your risk. It's everything. That doesn't mean that doing egg donation isn't a fantastic choice and a highly successful one. As a matter of fact, the success rates with egg donation can be 40% or even higher in a cycle. And the success rates with a woman's own eggs over 40 may be very low single digits, depending. But if she just needs to try, she should. Because you can't go back. Life is a one-way street. As we age, you can't go back. You can start over again, but you can't go back. So I think that you have to weigh it for yourself, the risks, the benefits. How important is it having a baby that you carry and being a mother, a parent, or having your own biologic link to that child? Many times, if a person tries once and they can live with if it doesn't work, they're going to move on. Then it may be a good thing to try once because you can let go. For other people, they say, you know, I want a baby. I don't really care. I can nurture a couch. I want a baby. If that's the case, just to prove it, just for the heck of it, doesn't make sense. And egg donation is where the success is going to be with much higher probability.